In Africa, where I come from, where this burden of HIV is huge, it's much bigger than here. They've been achieving very fast, dramatic declines in HIV infections. Jamaica can put more effort and achieve better results. We had targets for 2020. We call them treatment targets. We call them 90, 90, 90, meaning that 90% of all the people living with HIV in a country know their status, so have been tested and know their status. And the next 90 is that 90% of those who know their status are on treatment, taking treatment. And the third one is that 90% of those on treatment are virally suppressed. Because if you stay on treatment, the virus disappears in the body, and you're as good as a healthy person. You actually don't transmit to anybody else. So that's the 90-90 cascade. And we did the scorecard in 2020 to see where countries are. But also in 2020, we set new targets for 2025. Every 5 years, the world comes together and sets new targets, reviews progress and sets new. So now we have new targets of 95, 95, 95 in the same targets. So on 90, 90, 90, Jamaica was able to achieve the first 90, which is to get at least 90% of all those who are living with HIV to be tested. They know their status. But sadly, Jamaica didn't achieve the second. Neither did it achieve the third, the second. So we know that only about a half of the people who know their status are on treatment. There is another 50 or 51% who know their status, but who for some reason or another are not on treatment. That's worrying. And then in terms of how many are virally suppressed, we have, what's the number, Richard? 37. We have only 37% of those who are on treatment are virally suppressed. So this is not a good result. And Jamaica can do better. Jamaica can do better because even the average of the Caribbean is better than this. So we think that Jamaica can put more effort and achieve better results. If you look over time, you can see that in the last 10 years, Jamaica has been able to reduce new infections by 14% and to reduce AIDS-related deaths by 16%. That's significant, but again, could be better. In Africa, where I come from, where this burden of HIV is huge, it's much bigger than here. They've been achieving very fast, dramatic declines in HIV infections and in deaths. And if you take a country like my own Uganda, we have about 1.1 million people living with HIV. On your island, you have only about 33,000. But we're a bigger country also. We have more than 42 million people. But we have 1.1 with HIV. But in the same period of 10 years, I think we have reduced new infections by more than 30% and deaths by close to 40%. So you see that there are countries with a big burden, but who are moving faster towards ending AIDS. So Jamaica can do much more. Well, the first gap I noticed was that the data isn't very accurate. And that is always the beginning point, and a very, very important point, that you have good data, that you know your epidemic very well. If you don't, then all your efforts are in blindness. It's like walking in the dark. So I noticed that we don't have very accurate data about who is newly infected, where are they, who has died of HIV/AIDS, among the newly infected, who is gay, who is bisexual, who is a sex worker, who is a migrant. We need to have these details. Who is a prisoner, to know and to find them where they are. This data needs improvement, and I believe Jamaica has capacity. You are a middle-income country with a lot of state capacity. You can organize to strengthen that. And there are partners willing to help, like PEPFAR Global Fund, and ourselves, UNAIDS. So that's one. The other challenge I see is stigma and discrimination, because the data we have tells us that 81% of the people living with HIV have said that they tend to hide their status. 81%. So if they're hiding their status, they are not telling us about their lives. So they are not in the records. Or they're in the records, but not all the information is in the records. So there's stigma, strong stigma. Again, this is common with most countries where there's HIV, but we have to work towards reducing that stigma. COVID has blown us off track, and the war in Ukraine has worsened things by creating a crisis in the global economy. Our budgets are under strain. I think the first thing that we have to do for a country like Jamaica is to maintain its investment in the sectors of education, health, and social protection. These are very important for fighting any pandemic, including HIV. So maintaining these investments, even in these very challenging times where they are running a very tight fiscal policy, maintaining these and even increasing the spend there is very important. Secondly is that with the money that is available, to have really, really effective coordination that puts the money to where the needs are is very important. When you have, we call them national AIDS commissions or national AIDS councils, that bring together different departments from finance to health to education to social affairs to human rights, pulling them together to each deliver their bit, then you get a strong response. I didn't find one here. There must be many reasons why it's not there. But a national coordinating body is missing. And that might be the reason why certain parts of the response are not strong enough. It's certainly something for the government to look into, how to coordinate more effectively. Yeah. And thirdly, to work on the data, to be sure that they have the good data that helps them to plan an effective response. And fourth, to work on the policy environment, challenge stigma and discrimination. These are the things that will help Jamaica to get back on track. And it isn't hard for Jamaica to get back on track.